We are facing, with this coronavirus pandemic, the greatest public health crisis that has occurred in any of our lifetimes. And it's also a tremendous economic crisis also. And you can't really disentangle the two. Susan Michie said earlier that the health versus wealth debate was a bogus argument, and it is a bogus argument. Only if we deal effectively with COVID are we going to secure our economic future, both nationally and internationally. When we look at the public health crisis, we should remind ourselves of the terrible death toll. Here in the UK, we have one of the highest per capita death rates of anywhere in Europe. We have a total death toll approaching 90,000. And at this point, we're seeing a daily death toll of nearly, on average, 1,000 people dying a day. I mean, we've almost become numb to those figures, but they are frightening figures. They represent lives snuffed out, families in tragedy, and they're a standing indictment of this government's failure to take the right measures that have been urged on them for a very long time, and measures that they could see that on the Pacific Rim, countries like South Korea, Thailand, and also in New Zealand, measures they could see have worked elsewhere. And when you look at the health crisis, it's worth reminding ourselves of the way the most vulnerable have suffered. There's what's happened in care homes, which have had a tremendously high death rate, partly because in the last lockdown, the government sent people back into care homes from hospitals without being tested. And that seems to be a strategy they're going to try this time around. And look at students. People don't necessarily think of students as vulnerable, but last year, students were encouraged to go back to university and back to their halls of residence by university managers and the people at the top of the institution, purely for financial reasons, purely because they wanted the money for the halls of residence, purely because they wanted the tuition fees. It seems to me the way students' lives have been endangered in the course of this coronavirus pandemic, and endangered, again, they were warned by the UCU and Joe Grady, they were warned by so many people. The way their lives have been endangered actually is the height of the marketization of further and higher education that we've seen, which sadly started under New Labour. And of course, it's worth mentioning, you have to mention, the wholly disproportionate death rates of Black and ethnic minority people. In the early days of the pandemic, the majority of health service workers dying were Black and ethnic minority, and it remains the case that disproportionate numbers of doctors, nurses, social workers, care workers of Black and minority background are dying from COVID. It's also the case that disproportionate numbers of Black and ethnic minority people are dying, and the government says it's about underlying conditions. The government says sometimes they've said it because we don't understand the strategy. They're prepared to talk about everything except the institutional racism which underlies that disproportionate death rate. We've seen as well the way that social care workers and health workers in general have been infected and died from the pandemic. There has never been a public health crisis like it, and we have to hold this government accountable. But on the question of the economic crisis, one of the themes that has emerged throughout this economic crisis and the loss of jobs and the loss of business is Tory sleaze. How many mega contracts for testing and even now distributing vaccination is going to big, and I stress the big private sector companies and people like Serco and others who one way or another are linked to this Tory government sleaze.
Diane, can I just interrupt you with your 2-minute warning? Thank you.
So in closing, let me say this. So many thousands of lives have been lost. Such a illustration of the Tory over-reliance on the private sector, of Tory sleaze, of their reluctance to help ordinary workers, to allow them to self-isolate. So the death rate, the toll on business and jobs, all of this government must be held accountable for. And all of this, we must unite to fight. We're not getting leadership from the government, and you could argue that even the Labour front bench could be a little bit clearer in terms of what it's saying, and I'm putting that as tactfully as I can. So I'm very glad to be here speaking at this important conference. I'm going to continue working to try and bring people together on this issue, because for ordinary working people and for the population as a whole, this issue of fighting the coronavirus pandemic is literally a life and death issue. Thank you very much, Chair.